Hello everyone, I'm Haley. I am in the radiology program and this video is for our interprofessional education course on the case study of the 54-year-old man with necrotizing fasciitis. I am going to talk about how might care and outcomes be affected if some members were not involved in the care of this patient. And one that stood out to me was the video from the physical therapy perspective. So I was going to touch on that. Physical therapy can help with pain management. It improves mobility, it helps with balance, it can help you recover from a traumatic event, and more. But, so if a physical therapist wasn't involved after the patient all healed up, these are some of the things that they could be missing out on. Another was other team members I want to include in the care of the patient. Some really important ones are the X-ray techs, MRI and CT techs, because prompt diagnosis is extremely important as it limits the tissue damage. With necrotizing fasciitis, the tissue damage happens very rapidly, so it's extremely important to diagnose it quickly and act fast. Some other people that might be involved in the care of the patient were mentioned in the physical therapy video as well. He had mentioned an orthotist or a prosthetist, which I never thought about. He mentioned that a shoe insert would be a really good idea, as that would help with balance and being able to propel forward, where the great toe is important for weight bearing. Another one, how would the plan of care change if the patient was preschool age, teenage, or pregnant? So as far as being pregnant, we all know that that it's very important to protect a fetus from radiation. So an MRI might be a better option. The patient's provider would be able to recommend whether or not the risk outweighs the benefit of an X-ray. If it's extremely important, they get an X-ray and they think that the risk of exposing the fetus to radiation is going to be worth it. If that's going to be what helps the patient keep their foot, then that's a call that their physician can make. If the patient was preschool age, that affects us in the X-ray department if we were X-raying for diagnosis of necrotizing fasciitis, because getting a foot X-ray shouldn't really be that difficult, but with someone so young and I'm sure in pain and afraid, it makes it really difficult. So that would change our plan of care, because chances are we would probably need an extra set of hands in getting their diagnostic X-rays, whether that be parent, dress them up all in lead, preferably maybe a grandparent who's not within childbearing age. Let me check if that was it. I think that about covers it. So just a summary, I think it's really important that we have all team members involved, all hands on deck for caring for this patient, before diagnosis, after surgery. That goes as well with the physical therapy video that I really enjoyed. It gave me a lot of information. And yeah, I think that's it. Thank you.